Imagine if you or a loved one went in for surgery to replace a right knee and woke up having had your left knee operated on instead. What if you took your 12-year-old son with a high fever, vomiting, and severe stomach pain to see your pediatrician and were told he had a stomach bug and not to worry, only to have him die of sepsis 2 days later? We all expect the healthcare we receive to be the highest quality possible in whatever setting is offering the care. We expect our care to be safe, effective, patient-centered, timely, efficient, and equitable. We don't expect to be harmed or die as the result of care. Yet, unfortunately, all too many of us are not getting the quality of care we expect and deserve. Hi, my name is Dr. Jean Johnson, and I'd like to welcome you to the course. I'm the founding dean and a professor at the George Washington University School of Nursing. As a nurse who has been involved in quality improvement efforts for most of my career, I have focused on examining the role of the survey process in improving care in nursing homes, as well as working with policymakers to integrate quality improvement programs in nursing homes in many states across the U.S. I've also worked to develop the Quality and Safety Education for Nurses, otherwise known as QSIN. Those modules were funded by the Robert Wood Johnson Foundation, which have been integrated into undergraduate and graduate nursing programs nationwide. During my tenure as Dean of the School of Nursing, I also worked to offer the first master's level program in healthcare quality, and also a specialty area in quality improvement for the Doctor of Nursing practice students. My partner in teaching this course is Dr. Gregory Paulson, a physician who has also spent much of his career working on improving healthcare quality.
Welcome. My name is Greg Paulson, and I'm a physician with a long-standing commitment to understanding, measuring, and improving the quality of healthcare. Early in my career, I was engaged in research on outcomes of care and created innovative approaches to measuring quality provided by a geriatric service, as well as leading a department of primary care at the George Washington University. In the year 2000, I became the Executive Vice President of the National Committee for Quality Assurance, or NCQA. In that role, I had the opportunity to participate in the development and reporting of measures of quality in health plans, in physician offices, and in other clinical settings. Since leaving NCQA, I've continued my efforts in improving healthcare, working with the law firm of Saxton and Sump, devising strategies to reduce medical errors in physician practices. Doctors, nurses, and others providing healthcare go to work every day intending to provide good care for their patients. They adhere to the ancient Greek dictum of first, do no harm, and they believe that they provide the best care possible. Yet the seminal report from the U.S. Institute of Medicine that captured people's attention in 1999 indicated that nearly 100,000 people die in U.S. hospitals from medical errors and quality lapses every year. That's the equivalent of a jumbo jet crashing every single day. More exacting calculations from the work of John James and others suggest that the number may actually be much higher, upwards of 250,000 to 400,000 a year. More recent evidence suggests that the situation has improved in many areas, but overall, the improvement is still only marginal. The Centers for Medicare and Medicaid released data indicating that although 2.1 million fewer patients were harmed by hospital-acquired infections between 2010 and 2014, there has been little progress on injury from falls and from misdiagnosis. Evidence from other countries shows that the medical errors in hospitals are a significant cause of death around the world. As healthcare providers, we believe we're providing excellent care, but objective studies indicate that in all too many instances, that is not always the case. Why do we have such an unacceptable rate of medical errors and poor quality? Empiric studies of quality and safety suggest it is because we have not paid sufficient attention to building quality and safety into the technologies and the systems that we use, or indeed into the education of those of us who provide the care. or to measuring, monitoring, and improving quality and safety. In this course, we'll take a closer look at each of these contributing factors and provide you with an overview of strategies and skills that can start you on the path to lead or at least participate in critical quality and safety improvement initiatives in your own practice setting.
We're excited to be working with you and others like you who are interested in making a difference in the quality of healthcare around the world. Active involvement in quality and safety can save and improve lives just as surely as administering antibiotics to someone with pneumonia. We encourage you to connect, share experiences, and build a rich community of learning and practice. So let's get started.